Hi guys, Jazz here and welcome to another video. So for those of you who are new to the channel, my name is Jazz. I'm a consultant radiologist currently based in the UK. I did all of my training in Australia. I've worked there for several years and I'm currently working as a teleradiologist in London. So today's video, basically I'm going to be starting a subset of videos where I'm going to explain common and kind of typical CT or ultrasound guided procedures that patients might have at a radiology clinic, and just to give everyone a bit of an idea of what the steps are, what you can expect, and this is kind of guided more towards patients. So in this video, I'm going to be talking about a CT guided epidural injection. Now, firstly, the reason your doctor might have referred you to get one of these procedures will probably be because you're getting some sort of back pain. It's potentially radiating down to your legs. Could be one leg or both legs. You've probably had some imaging done, either a CT or an MRI of your spine, and that might have shown some sort of disc protrusion or a disc bulge that's irritating one of your nerves, and that could be the source of your symptoms. Now, you've been referred to get this procedure done, a CT guided epidural injection. So what can you expect? So basically, you'll get your referral form from your GP or whichever physician is referring you to get it done. You'll turn up to the radiology clinic. Now, first, obviously, you'll line up, you'll do all your paperwork, and a radiographer will probably come and have a chat to you. Now, a radiographer is one of the technicians who will usually perform the scans, and they'll help the radiologist with doing the actual procedure itself. Now, they normally will run through, obviously, the explanation of the procedure and go through certain risks with you before the doctor will probably even come and see you. And they'll also ask you for a summary of your symptoms as well, as this is kind of important in kind of planning of the procedure itself. Now, like I said before, you might be having symptoms either in one leg or both legs, or it might just be localized to your lower back. But all of these things will kind of help guide the treatment plan for you. That's why it's important to kind of be familiar with your symptoms and be able to kind of explain them well to the radiographer and the radiologist. Now then, you'll probably you'll get changed into a gown for the procedure. Like I said, the doctor would have come and spoke to you as well, go through consent and all that kind of thing. Just make sure you have a good understanding of the procedure, and then they'll also ask you whether or not you have any questions. And this could be a good time to ask any questions or any hesitations that you might have. But obviously, at any point during the entire procedure, people will be talking you through everything, and you can very much ask any question you want whenever something comes to your mind. So then next, you'll be taken into the CT room. So the procedure is done under imaging guidance, and in this case, most of the time it will be done under CT. So you'll be taken into the CT room, which is like any kind of clinical or hospital type of room, usually kind of, lino floored, and then obviously the CT scanner in the center of the room. And then the first step will be to get you onto the table. So you've got the big donut, and then you've got the bed in the middle of the donut. Now, in order to do this procedure, the needle and the procedure will be done through your lower back region. So obviously that will need to be facing upwards. So you'll be lying on your belly typically for this type of study. And that's the way the procedure will be done. It doesn't take too long. So if you are worried that, you'll find it quite uncomfortable lying on your belly, it is quite quick. And the radiographers will also try and position you as comfortable as possible, whether that means, using some pillows to kind of raise parts of your belly or possibly your knees, just to try and limit any of the symptoms that might come on from you lying on your belly, just to make it as comfortable as possible. So we've got you lying on the table now. Then what will happen is the radiographer will then do like a planning CT scan. So this is kind of the markup stage and the planning stage to try and work out exactly how the needle is going to be guided to the right spot, which in this case will be the epidural space, which essentially is the lining around your spinal cord / spinal canal, and it's the area that a lot of the nerves and nerve roots that pass out come through this region. So this is the region that's going to be targeted in this injection. So planning scan will happen. That's a very quick process. Quick scan of your lower back. And then after that, the radiologist will have a look at the pictures along with the radiographer, and then kind of plan the path to attack this essentially. So we'll mark up on the CT scan images themselves, work out the exact trajectory of the needle and exactly how far the distance is as well, because that will help us to work out exactly how long of a needle we need in order to do the procedure. So I've done all that, everything is marked up, then the radiologist will come back into the room, and then your skin will be marked up firstly by the radiographer as well. So while you're lying on your back, they'll basically initially would have scanned it most likely with some sort of grid on your back, back, which is just like a little sticky template that goes on your lower back, and it just provides some markings on the CT scan to help work with all the measurements that are required. Then after that, they'll come back and just put a small texture mark on your back essentially, and that will be the needle entry point on your skin. So that's all done now, and then the next step basically, the radiologist will come into the room. Now, first things first, we'll start with some antiseptic solution on your lower back, generally a cold alcohol-based solution. So this is usually pretty cold, and most patients generally are a bit startled by how cold it is. But again, that obviously just kills all the bacteria and reduces any risk of any possible infection. So that's done, the skin's nice and clean. Usually put a drape over the skin then as well, again, to minimize any chance of infection. And then usually there'll be a little bit of local anesthetic that will go into the skin. Now this usually is quite stingy. People are generally surprised again if you haven't had local anesthetic before. It does sting quite a bit as it numbs up under the skin, but that's usually quite quick as well, and then it will numb up quite nicely. And then after that, basically, as the next needle goes in, usually you only feel a bit of more of a pressure and pushing kind of sensation rather than any sharp pointing or, you know, poking kind of sensations. So once the local anesthetic, given that a bit of time to kind of kick in, then we'll get the next needle, which will be the spinal needle. Again, it's quite a small needle, really similar in caliber to like any type of, you know, small vaccination needle, but it's obviously quite a bit longer because it has to go through a decent amount of space to get to that epidural space. So then the needle will go through the skin, and for those of you who don't have an anatomy background or have an understanding, so basically it'll go through the skin layer first, and then you've got all your muscles that surround your spinal column and where the bones and the actual nerves are. So then you traverse through the muscles, so the needle will go down, and during all of this the radiologist will be guiding the needle using the CT machine essentially to guide it exactly to the right spot. So you might find that they move you in and out, or either, you know, slightly adjust your bed level within the gantry of the machine, which is the whole of the machine. So they might move you in and out slightly as they kind of maneuver the needle down to where it needs to go. So once you get down close to that space, usually they'll be talking you through this as they're getting close to the right area. And then once it's into that space, the needle tip position is usually confirmed, generally by injecting either air or some contrast, which kind of lights up on the CT scan as well, and it tells the radiologist that they're in the right space. Now, the thing for the patient to be aware generally when this happens is that sometimes you might get that same pain or sensation down your legs, because this kind of air or contrast material is going to flush around that area where the nerves are, particularly the irritated nerves that have been targeted for the injection. So you might get a brief sensation of the symptoms that you usually experience, whether that's the pain or numbness or tingling down your legs, and it can be a little bit uncomfortable, but again, it passes quite quickly. Then once the needle's been confirmed to be in the right spot and they're happy with the way that the contrast or air is kind of filling the space, then they'll inject the medication. And again, with this, as there is usually a bit of local anesthetic and a bit of a steroid, that's usually the combination of medications that are injected. Again, it might precipitate or kind of cause some of the symptoms to reproduce themselves the same way as the contrast or air injection might do. But again, it's quite quick, and then the local anesthetic in the medication in the injection usually kicks in quite quickly, and you usually will feel quite comfortable quite quickly. So that's basically how the procedure works. That's the steps involved from kind of walking into the clinic and getting the injection done. Obviously afterwards as well, you got to take care, as you might get some weakness in your legs. That's all kind of normal, just because that local anesthetic and usually just lasts for a few hours and then it'll wear off. And then the most important thing after any of these procedures is that you have to take it easy. So, you know, limit your physical activity. No, you know, carrying heavy boxes, or, you know, no going to CrossFit or anything like that. You have to take rest, and that will all just help with the healing process. And usually a lot of patients sometimes are surprised and unexpected that it does take some time for the medication to fully work. So to get the best result and to really gauge whether or not this has helped you, you usually wait about a week, and then it's usually good to have some sort of pain journal as well. If you document what your pain was like before, and then obviously on the day, and then as the days kind of progress through that week, and then kind of get an idea of whether or not this injection has helped you. And again, with whether or not it's helped you, that's also, back pain is usually a pretty complex thing, and it can be quite multifactorial. I think a lot of people expect that one injection might sort absolutely everything that they've got wrong with their back, but sometimes you might need a different area injector or a different type of injection as well. And like I said, I am going to make a bit of a series, so I will explain and go through some other procedures as well. But if you have any questions, feel free to write them in the comments down below. If you're new to the channel, please consider subscribing, and I'll catch you in the next one. Cheers.